Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great exercise for those of you with lower back spondylolisthesis, the standing crossed extension exercise. Hope you enjoy. While many spondylolisthesis lower back rehab exercises emphasize the abs and flexion to help hold the curve in the lower back from extending too much, oftentimes the missing ingredient in self-rehab programs is training extension under control. The upper body and lower body crossed extension standing exercise is a perfect way to implement this training into your spondylolisthesis rehab. The exercise is performed by maintaining a neutral spine, which we've covered in different videos on this channel, and then maintaining an arch in your back to make sure that it's not going to overarch to the point of causing symptoms. This is done by holding some degree of posterior pelvic tilt or tail under tension with the abdominals, as well as a slight crunch down with the abdominals, and making sure that your spondylolisthetic vertebra is tensed backwards using your lower back erector spinae muscles at the lower levels, especially for L4 and L5 spondylolisthesis cases. Once you have your core set and your spondylolisthesis vertebra held in a neutral position, you'll then perform the crossed extension movement by raising one leg backwards and one arm up and backwards. You'll hold that for a second or two, and as you perform this, the key is maintaining a comfortable amount of arch. The tendency is the further the arm goes back and the further the leg goes back, the lower back arch wants to increase, and you're resisting that. You can monitor that with one hand in your lower back using your knuckles right in the center to make sure that the arch that you've set before you begin the movement is the same amount of arch that's maintained during the movement. If you maintain this, you'll be preventing yourself from causing extension stress on the spondylolisthetic vertebra, and you'll be training yourself for real-life activities that include extension without hurting yourself. This cross-extension exercise can be used anywhere from 8 to 20 repetitions to activate the extensor muscles of the lower back and relieve low back symptoms, and can be performed anywhere from 3 to 10 times per day. You can also progressively build up your repetitions 3 times per week, leaving a day off between training, to increase the endurance effect of these muscles over time, eventually building to several hundred repetitions. An advanced form of this exercise can be done by using bands attached to the opposite arm and ankle for added resistance. So plug this exercise into your lower back self-rehab program and let me know how you make out. Questions or comments, feel free to write in. Give me a thumbs up to help share this valuable information with others. Subscribe to the channel to get more great training videos on how to overcome your injuries. And remember, if you're looking for a great step-by-step program to figure out what your muscle imbalances are, where your posture and movement errors are, where your joint stabilization issues are, and how to step-by-step build a self-rehab program for your lower back discomfort, check out our many healing exercise programs for lower back pain at painfreeandfit.com.